Hey there, in this video, let's talk about hip pain, arthritis or bursitis. Hi, this is Obunwei, your exercise physiologist, here to help you better understand your body so that you can improve in your fitness, health and your performance. Right, so in this video, we are talking about hip pain and specifically arthritis and bursitis around the hip. So if you have done enough research, you realize that it's both different things. Arthritis basically just means in between the bone and it's causing some irritation, some rubbing and articulation of the joint, and that's causing the inflammation. Okay. On the other hand, bursitis is basically this, I'll call it tissue in your body that is known as the bursa, B-U-R-S-A, and once it's inflamed, then it gets the name of bursitis. Basically, anything that you hear about itis, ending with itis, just means inflammation. So it could be arthritis, osteoarthritis, bursitis, whatever itis, just means inflammation. Okay, so you get inflammation around the joint, and there are a couple of reasons over here. So if you're searching and you're looking around for this term, basically you may be, I don't know, just trying to find out what's happening around the hip and that is causing you pain. So let me draw it out so that you can better understand where is the arthritis and where is the bursitis, and you can then better understand what's the difference and whether you have pain and where is it and what is it. Okay. So over here we have our hip joint. Think of this more like your thigh bone. Okay, this is where your leg is. This is your hip area, right? This is where your leg is, start of your leg, and this is your pelvis, right? So this is basically how the hip joint looks like. It's basically a socket joint. So if we talk about arthritis, it usually happens where this reddish area is. So there are actually many reasons why people can get hip pain, and inflammation is just the easiest way to tell people that they have pain. Get the inflammation cleared and you should be okay. But most of the time, even before the inflammation kicks in, you have to understand why it's causing the inflammation. Anybody can just clear the inflammation, and that's very easy. You just have to ice it. You can take painkillers plus anti-inflammatory, which is easily available. But the main thing over here is that you need to understand what's causing you the inflammation, right? There's no point clearing the inflammation again and again just so that you feel lesser pain, but you have no idea what's causing you the pain, which in this case, the inflammation. So in most cases, when inflammation comes in, it's a lot tougher at that point of time to figure out what's giving the patient or the client the inflammation, because all they do feel is just pain. Most of the time, you want to clear the inflammation, which, yes, you ice, you take anti-inflammatory pills, tablets, a medicine, and you want to clear it away. As a patient, you want to visit somebody who knows what can cause the inflammation. You can clear the inflammation, you can continue to take the medication. Most people will not have any problem doing that. That's very easy. But you have to find someone who can tell you what's causing the inflammation. So although this topic we're talking about the arthritis, the bursitis, these are just the area, the site that can cause inflammation. So arthritis happens around the joint. Bursitis happens on or in the bursa. Around the hip, these are the 4 known bursas marked in blues. Okay, you can easily find them, and this area don't give us much clue when you feel pain over there. So of course, If it's the irritation of the bursa, maybe anything that you have been doing, 1 time, 2 times, I think that's okay. But if it keeps coming back again and again and it's causing you inflammation and pain around the area, that just means that there is something that's irritating your joint and that's causing you the pain. So in cases like that, you don't want to just ignore, you want to find out what's giving you the problem, because, well, in my opinion, nobody wants to take medicine for the rest of their life. And that doesn't make sense. If you know that it's a mechanical problem, you want to fix it. Mechanical, here, we're talking about how you're moving, what's causing you hip pain. Okay, so earlier on in my video, one of my videos, I talk about hip pain after squatting. So for some people, they may not even be squatting, they may just be sitting a bit, they may be not doing any form of exercises, and that's causing them the pain. Well, then you have to figure out or find somebody to help you figure out what's giving you the pain, because there are many muscles around here. Again, my previous videos, I show you what are the muscles around here, whether you're coming from the front, whether you're coming from the back, whether you're coming from the side, it's covered, so you can look it up over there as well. So when we talk about mechanical, often we talk about muscles over here, because if the muscles are not working properly and your joint is going to take up more load than usual rather than the muscle, then the root of the cause of the problem, the root of the problem is basically the weakness of the muscle. So if you are not fixing the root of the problem, you go and get your operation done, you keep taking painkillers, there will be no end to it, because this is what's going to happen. After taking medication, the inflammation is cleared, top maybe 2 weeks, 3 weeks, 1 month, the pain will come back again, and then you will want to take medication again, and this goes in a cycle, right? For people who prefer operation, yes, I do agree that in certain x-rays or in certain MRIs you can see something over there. Again, my question would be, why is it causing some deformity, or why is it that only this part of the joint is showing something? If you happen to be both sides, then you will be easily convinced that this is just wear and tear, right? Old age. But if it only happens to one side, then you really got to question whoever that you are seeing to give you a better answer, because wear and tear doesn't happen to one side only, it happens both sides. Degeneration doesn't happen to one side only, it happens both sides. But if you know that you are always using the right leg and it's giving you, for example, right hip problem, then the problem may be the right side, right? So you got to think through, everything has to be logical, it has to make sense to you. So this is something that I just want to cover. Although you may be looking at arthritis, bursitis, these are just the symptoms that's giving you the pain. It doesn't tell you what the pain is, right? So this is what I want to cover in this video, and I hope you do learn something from it. So again, clearing inflammation is very easy, but finding out what's giving you the problem takes a longer time. So you may want to find somebody who can help you with that, right? So that's really it for this video. If you like this video, don't forget to share it, don't forget to subscribe, don't forget to hit the bell, and let me know if you have any questions. You can always put it down in the comment section below, and I'll see you in my next video. Please take care. Bye bye.